That's really what it's about, making sure that the patient has somebody as well that they can reach out to that can explain the benefits of the different plans, because there's differences between each of them, right? So it's making sure, part of my job is to make sure that their doctors that that patient has are in network. So it's, if they choose XYZ plan, that they can keep their doctors, right? It's definitely one of the main things that people worry about, their doctors and their medications, if they're on any.
Hi, this is Dr. Ross Carter with the Regenerative Warrior Show. Today, my guest is Lorena Tomasini. Welcome to the show today.
Hi, Dr. Carter. Thank you so much for having me on.
Now, you had brought up a topic that I had not thought about, which is patients when they're changing insurance, especially if you have like patients that you've worked on for quite a while, and now they're becoming they're going into Medicare. They have a choice for choosing, make different plans, and you as the doctor may not be a part of that plan, and it's something somebody should address. Isn't that correct?
That is correct. Yeah, there's a lot of options out there for patients to choose. So it's important, for them to choose a company that you're a part of as a doctor. Mm-hmm.
Exactly. And so this should be something that the staff should be doing. Their office manager, for example, what would you recommend that you tell that the doctors tell the staff to do? What would be the protocol?
Yeah. So one of the key things is communication, right, with your patients, and one way of doing that is seeing who in the next 6 months, for example, is turning 65, right? Because what happens, especially here, I live in Miami, and it's very common that when people are turning 65, they get a lot of phone calls and they get a lot of things in the mail from different companies, from insurance agents, right? And so it's important for your office staff to be aware of who's turning 65, to reach out to them. And we can talk about, different ways of reaching out, so that they're aware, okay, so these are the companies they accept, or, so at least they have an idea of what companies might be a good fit for them.
So a patient, somebody's turning about 65, or turning 65 or within 6 months, they're going to be getting, marketing letters and things from various insurance saying, hey, we're part of Medicare, and, switch to us, it might save you money, or whatever, this, that, and the other. And the patient might not be thinking, is my provider part of this network? And so what you're doing is a proactive approach, where you're reaching out to the patients, because they're going to be getting stuff, and saying, hey, here are the plans that we're a part of. If you don't want to change, then you should use one of these selected these insurance plans, correct?
Correct. Yeah, it's important that, for example, a lot of doctors, what they'll do is they'll send a letter to their patients saying, hey, you can reach out to Lorena, for example, who is a broker. And what a broker means is that I represent different companies. Mm-hmm. And then, we'll see what companies the doctors work with, and if it's suitable for the client as well, right? We'll make sure to so that they're aware of all the benefits of the plans. So that's really what it's about, making sure that the patient has somebody as well that they can reach out to that can explain the benefits of the different plans, because there's differences between each of them, right? So it's making sure, part of my job is to make sure that their doctors that patient has are in network. So it's, if they choose XYZ plan, that they can keep their doctors, right? It's definitely one of the main things that people worry about, their doctors and their medications, if they're on any.
Got it. Well, good. So basically what we're talking about is if you need to make sure your staff is keeping up with the ages and the birthdays, especially at 65, to notify their patients, to inform them that they should make sure to remind them which insurance plans you're part of, so they don't suddenly come in for a treatment and have a surprise bill.
Exactly, exactly. And for the office, it's a great way to maintain their patients, right? That maybe they've been helping them with cardiology or diabetes, right? Or they're just a primary care physician. So
Perfect.
it's important, you've worked with this person, so you want to make sure that even though they're turning 65, it's something you can continue doing.
I think that's great advice. And if somebody has questions or wants some advice, how do they get in touch with you, Lorena?
Sure. So the easiest way to reach out to me is my phone number, and that's 786-236-1792. Again, that's 786-236-1792. And I also have a website, malmins.com.
Perfect. And you're in Florida, so would the questions only pertain to Florida plans? Would that be your special area?
Yes, so I mainly work Miami-Dade, Broward, and Palm Beach, but I do work the entire state of Florida. So
Okay.
if it's somebody in Tallahassee, I can help them out as well.
Perfect. Well, thank you for your time and good advice that we all need to think about as we get older. So, want
Thank
to
you
keep our
so much.
patient base. It's one
Yeah.
thing to get new patients, but it's better. It's also good to keep the current ones you have.
Well, the other thing as well too, I do want to mention is
Yep.
that a lot of times clients will ask us like, hey, do you know a cardiologist, or do you know this type of specialist, and if we've built that relationship with different doctors' offices, we can always refer them 2 or 3 doctors, that they can call.
Should doctors or doctors' offices reach out to the local brokers in the area?
I think so, because we're a great resource. At least I am certified with different companies, and each year we have to do certifications. So we know the ins and outs of the companies, right?
Right.
And yeah, we're the ones who are kind of a link as well between the patient and the doctor sometimes.
Perfect. Well, great advice. We thank you so much for your time today.
Thank you so much.
All right. Take care.